those, even though you are not good in coding and IT, but you now with the help of ChatGPT, you can write your own code as well, even though you are not trained in computer science. Okay, let me see. Okay, yeah, Dr. Andy also having another class, so no worries, Dr. Andy. Okay, now let me. Is it record? Let me record the sessions. Okay. Okay. I can't
Sorry,
record it. It's fine.
sorry, Long,
Yeah.
you cannot record it. I haven't said it yet.
I
Okay.
Okay. No problem. So shall I start, Dr. Andy? Yeah. Okay. Right.
Yeah, sure, okay.
You're seeing the full screen, isn't it? Are you seeing the full screen now on your
Sorry?
screen? Is it on full screen or a presenter mode that you see?
It's I think it's just showing
Full.
the flyer.
Okay. Good.
It's the presenter mode. Yeah.
So, okay, not presenter mode, right?
Yes, now.
Okay. Okay. Good. Because sometimes the depending which type of screen the presenter press. Okay, so pharmacy, if you can trace back centuries ago, okay, we coexist with medicines. It used to be together, medicine and pharmacy, but with the evolving of time and practice, the separation, dispensing separations are very important because it helped to make sure that the medicines is have a counter checking or check and balance. So the doctor is going to prescribe and the pharmacy is going to check the prescriptions and then it dispense. Also, so it prevented the doctors from over prescribing, okay, for the purpose of profit. So that's very important, the dispensing separation, as you see with dispensing separations and also a development of pharmacy. You see that the pharmacy have grown now from a traditional compounding to various pharmaceutical manufacturing and also use of online pharmacy. Okay, let's try first. This one you doesn't is suitable for year two students. Can you type your answer on the chat box? Look at these MCQ questions. Please type your answers on the chat box. Okay. Okay. More answers, please. Okay. Okay. I think most of you get it correct. Yeah, answer is C. So the surgical procedure, obviously, in our undergrad, I mean, in current specialization still, okay, we doesn't involve surgical. We don't do surgical procedures. That one is still specializations for medical doctors. We're focusing still more on the pharmacotherapy and medicines and its management. Okay, so everyone got it correct. So let's take a look now. What are the traditional roles of pharmacy practice, and it can be at the can be enhanced by ITO. Okay, let's look at the first one. Preparations of the pharmaceutical form of medicine product, which compounding you have been doing. This one at the larger scales, manufacturing at the factory, and also when you are manufacturing at the factory, you must make sure that is the product is safe. You need to test it free from all these micro bacteria and also heavy metals. Okay, this one also you are doing your lab for the pharmaceutical product in your pharmaceutical technology practicals. Okay, this one to make sure that number D. Okay, storage. This is part of the supply chain, including ordering as the supply chain pharmacist. Okay, preparation, testing, storage. This one is at the community pharmacy level. Okay, when you as a primary care, you operating a pharmacy and then provide the medicines to the patients. Okay, this one at the hospital level as the hospital pharmacist. Okay, you have an inpatient pharmacy providing medicines to the patient in the ward, and outpatient pharmacy providing patients for the discharged patient or outpatient patients. Okay, and also last and but not the least, providing drug info. Okay, even though there's a lot of information can be found on the internet now or ChatGPT, you need as a pharmacist you need to validate all this information to educate the patients to see which if the information is relevant to them. Is it correct or relevant to them? So this one, you know, the answer is C is correct. Yeah, well done everyone. So at the time here, the information technology is very important because it helps to reduce medication errors. Okay, or sometimes it's called pharmacy errors. Okay, what is medication error? Okay, if you see from these definitions, it's a preventable event, because if it's not prevented, it can cause wrong medications being used to the patient and harm the patients. Okay, what kind of process that can give rise to medications error? Okay, for example, during professional practice, healthcare product procedure during the system, such as during when a doctor trying to prescribe medications, when the order is either electronic order or printed prescriptions, when a pharmacy putting this label on the product, for let's say patient A product amlodipine, the the label should be for amlodipine for patient A. Packaging, is the information on the packaging, is it correct? Nomenclature, is it the labels correctly produced? If is the compounding prepared is correct, let's say for example containing 5 milligrams in 5 mils, is it really 5 milligram of medicines? Okay, dispensing to the patients, distribution, administrations. So all these things could have a medication error. Okay, so you want to make sure the medication error is reduced, is minimized. Okay, because if not, then it will lead to severe consequences. For example, patient death. For example, in US, more than 98,000 death case annually is caused by the medication error. For example, wrong drug administered to the patients and patients suffer anaphylactic shock, or wrong medications given dispensed to the patient and patients taken wrong medications. So you as a pharmacy students should make sure that you absorb and then you have all the pharmacotherapy knowledge that you should before you start working as a pharmacist later on. Okay, take a look at the use or application of IT in pharmacy informatics. Okay, this is relative a new field for pharmacy. Okay, it's called pharmacy informatics, or also called pharmacoinformatics. Okay, what is a pharmacy informatics? It's a subset. It's one of the branches of health informatics. So you have bioinformatics, health informatics, and then pharmacy informatics. So it involve both the clinical expertise and knowledge of using information technology with the ultimate aims of improve the medication manage process and also safety of the drug administrations, which means that patients receiving the right medications and also their conditions, their treatment improve because with the use of pharmacy informatics. Okay. So who are the informatics pharmacists or health informatic pharmacists? Okay. So are the pharmacists with very strong knowledge in both the clinical pharmacy and also knowledge about medications, pharmacotherapy, and also with extensive knowledge in clinical information system, which I'm going to do later. Okay, in the electronic health record. Okay, so I just want to highlight, if you want to read further about pharmacoinformatics, you can Google. I'm going to share the slide with you later. Yeah, okay. I think I'll put it on the chat box, which you can download. Okay, so if you see, you can read further about the pharmacoinformatics from the review paper that I have published before. Yes, Adelia, do you have any questions? Go ahead. You can unmute yourself. Feel free if you have any questions. I saw you raise your hand, Adelia. Are you going to? Do you have any questions? If not, then we proceed. Okay. So what the next activity you want that we're going to do is you watch this video and then please take a paper or use your phone to write down, okay, what are the responsibilities of informatics pharmacist and its job prospect. Okay, and because I'm going to ask you to write down all these informations later. Okay, so the role of informatic pharmacist, I'm going to play the video now. Let me um,
Hey Brian, what's up? What's a typical day look like for an informatics pharmacist? Well, it kind of differs from one informatics pharmacist to another, but let's talk about it. Hi, my name is Brian, and I'm an informatics pharmacist interested in connecting the world's healthcare data. In this video, I hope to provide a glimpse of a day in the life of but this can also be a difficult question to answer because there are so many variables that go into defining our roles and responsibilities. However, they all typically revolve around the medication use process. Where you work, how large your organization is, or whether you report to pharmacy or to IT are just some of the factors that could dictate where your roles and responsibilities reside. It could be all of it or selectively focused on certain aspects of it. So my day usually starts with a cup of coffee. After it's brewed, I usually spend the first 30 minutes of my day reviewing issues that may need urgent attention. This could be new incident tickets that were submitted by end users for things that are not working, or emails that require a more urgent response. Depending on the issue, I may end up acting on it right away, which could take up the entire day, or pushing it for later to triage if it's not urgent. Next, I'll review the tasks I'm currently assigned and then determine which ones I actually need to work on. Oftentimes, tasks have multiple dependencies and I'm unable to proceed further until another team has completed the work. It's not uncommon to be juggling 15 to 25 tasks because of that. All the tasks usually involve some component of build, test, analysis, or documentation. For example, one task may be to build a new value set of monoclonal antibodies used in a registry, or another may be to analyze the requirements of a new report needed for medication therapy management. In doing so, I'll also have to test the build to make sure it functions appropriately, and subsequently document my work for knowledge management and then migration purposes. After I'm done reviewing, I'll determine which work items need to be prioritized and then schedule them into the free time slots on my calendar. And this is really helpful because it helps me visualize what the day will look like, but it also helps with planning when I have to make decisions about feature trade-offs or provide updates to different team members. The other parts of my day are usually spent in various meetings, both unscheduled and scheduled, which could be with stakeholders to scope out a new project, assess build feasibility, or just be in attendance to answer any questions from an informatics perspective. I also spend a lot of time in meetings with both my informatics team and others to discuss progress on projects and build strategy. These frequently include representatives from our vendors, notably those from our EHR, but we usually meet with them independently as well when we run into technical roadblocks or need help with troubleshooting system behavior. As the day progresses, I may end up reprioritizing my tasks as new incident tickets, emails, and chat messages come in that may require my immediate attention. Alright, so that wraps up this video about my typical day. There's certainly more nuance that I could get into, but hopefully this gives a glimpse of what it's like to be an informatics pharmacist. Thanks for watching, and I'll...
Okay. Sorry. Okay. Yeah, it's quite brief, not too scientific. So briefly, if you can see, he have shared two main slides about what are the activities involved as health pharmacoinformatics, and also what are his involvement. Okay, so can you please type your, let me back to my slides. What are the activities conducted as informative pharmacist on the chat box, so that each one of us will be able to look at it and then see if you get it correctly. Start by putting your answers on the chat box, please. Yeah, okay. So sharing is paused. Okay, I still waiting for your answers. So from the video, what kind of role of informatics pharmacists that are being described just now? Okay, let me see. Yep. Thanks, Ilio. Monitoring of medical data, correct? share my What else? What else Brian have described just now? Yes, Natalie. Monitoring, dispensing, administration, transcribing, and verifications. Good. I think you got it. So he's describing also how he build test analysis and also document all these activities as part of the. So it seems rather generic and superficial, but if you recall back the definitions of informative pharmacist, so that you when you work as health informatic pharmacist later on, you need to incorporate all your clinical knowledge and also your applications in the applications of clinical information system, which is part of it is maintaining and also ensuring electronic health records is operating smoothly. Okay, I would like you to take a look at this two MCQ, which going to once you then I'll show you that slides about the circle, clinical practice circle. This is the first questions. Take a look at the question now, which I'm going to show you this question again. So this is the first question. Okay, this is the second question. So why you have to study 4 years for your pharmacy degree? So license done or 2 years to get the pharmacy certificate. Okay. So if you can see here, even though just listed four primary activities, okay, or area, but it involve a lot of details knowledge. Okay, take a look at the first one. First, you need to understand about the disease and their treatments. For example, hypertension. What kind of antihypertensive drug available? Okay, and what are the doses on patients with different conditions? For example, uh, pregnant lady with hypertension, kidney disease with hypertension, diabetic hypertension. Which one is more superior? Which antihypertensive drug is more superior? Okay. So based on the clinical data, which derive or gather from clinical trial, okay, and also practice guideline, different practice guidelines. Let's say clinical practice guideline for that hypertension. Okay, then you get to plan as a pharmacist your pharmaceutical care plan for individual patients. For example, what kind of antihypertensive drug you want should be started that you need to recommend to the patients, sorry, to the doctors, so that the doctors will consider. Okay, uh, what kind of potential adverse drug reactions or side effect the patient might experience. Okay, so when the doctor have prescribed it, when the time you're going to dispense it, either in the ward as a bedside counseling or in your community pharmacy. Okay. So also you need to interview the patient to make sure that the patient doesn't have compliance or adherence issue, means that the patient's able to take the medications as prescribed. Okay. So that when making sure that when the medicine is dispensed, the 4 hour right patient, right dose, right times. Okay. is given to the patients, and also patients know how to take the medication correctly. Okay. So at the broader level, let's say you're working in the outpatient pharmacy in the hospitals. Okay. So on the daily basis, then you have to see how many you have to record how many prescriptions being dispensed, how many patients are being uh dispensed with their medications. Okay. And then you compare it on an monthly basis, uh, and then you submit all these informations to the chief pharmacist, to assess how whether which kind of medication errors was made, how you can reduce or prevent further medication error in futures. Okay, so with that, okay, you improve on, for example, about the disease. Okay, how to treat patient better. Okay, if it's for example the patients come in for the next visits, then you will know that if the patient's hypertension is being controlled. Okay, if it's not controlled, why is the patient not taking their medications, or do you need to increase the dose of the medication or antihypertensive drug? So that is the circle that we mentioned. Then you improve on, you change your pharmaceutical cap based on the current visit. Okay. So here you want to make sure that in the pharmacy management, you are making sure that the procedures are well followed, means that to reduce the medication error by counter checking each time when the label is printed, and then putting on the packaging and then dispense to the patients. Okay. And here this is the also involve clinical engagements, means how you interact with the patient, and also post-marketing surveillance, meaning the pharmacovigilance, or whether the reporting of adverse drug reactions. Okay. And also data mining. Here the next slide going to discuss about the medical research or clinical practice. So all these informations will be captured either through a handwritten record or electronic health records. So these health records, imagines you have in the one hospitals, you have thousands of patients, and then thousands of patients with their thousands of medical records, start from birth, uh, or up to their current treatments. For example, if they have been visiting the hospital for the past 10 years, all the 10 years records, including all their change of their body weight, change in their drug records, what is their performance in terms of their lab results. Okay, is their hypertension is being well controlled, or is their creatinine is in the recommended range, or is in the correct rate, is in the range, or is it or if their creatinine value is high, which means that something, then we need to monitor their kidney function. Okay. So now I assume that you should able to get the answers now. Can you type the answers on the chat box? Because we have just gone through this one. Okay. Look at these questions and then type your answers on the chat box, please. Okay. Answer A, B, C, D. If you don't understand, maybe I can go back to the slides again. Please type your answers on the chat box, yeah? Okay, thanks, Sophia. A. Okay, good. Thanks for responding. Yep, I think most of you got it correct. If you recall back, on the top right-hand side, first thing, pharmaceutical care plans to understand the patient's diseases and also recommend what are the potential treatment. Okay, correct. Okay, let's look at the second question. I briefly mentioned about the health records. What are exactly these health records? Okay, good. Think everyone got it correct. It's B. So the electronic health record is essentially is a repository, like a library of medical records. Okay. Okay, so let's move on. Let's look at this case study of electronic medical, or sometimes it's called electronic health record, or EMR or EHR. Okay, normally we call it EMR, electronic health records. Okay. For those hospitals or clinics using handwritten records, even though electronic record is used, but most of the hospital they use hybrid system. They still have the printed records. So one of the things is you can see this involve large volume of printed materials and then compile, and then you have to compartmentalize based on the patients, normally based on patient alphabetical orders lah, A, B, C, D. Okay. So for this is an example electronic health records. In here in this particular tab, is written down patient's family history, smoking history, alcohol consumptions, because you need to know the drug and alcohol interactions with the medications. Okay. What are the interventions or treatments is given to the patients. Okay. Here for pharmacists, then we will look at the SOAP notes. What are the subjective parameters, for examples? What are the complaint of the patients? Objective, for example, patient's temperature. Okay, is it patients is having fever? Assessment, what have been done? For example, any blood tests have been done. Plan, what are the plans for the patient from the doctors for these particular patients? For example, to start paracetamol. Okay. Follow up, for example, what need to be done next to make sure that the patient's fever is controlled. Okay. So let's take a look at the definitions of electronic health record. Okay. It's a, as I mentioned, it's a library or full documents of the informations for here written single patients is for all individual patients, including all the clinical patient demographic and also their pharmacy data. How many, what are the medications prescribed, medication dispensed, what are the payment involved. Okay. So the expanded versions of electronic health records also is part of the information technology system in the hospitals, whereby the doctors, when they prescribe, then they will receive the alert or what the dose is, it overdose, okay, or with, let's say, patients previously prescribed with aspirin, then if the doctors, it's a chronic medications, right? So the doctor need to continue prescribing aspirin to the patients. And if it's not prescribed, then the reminder straight away will pop up to say that, oh, okay, please, patients, as stroke patients need to be aspirin. So then the doctor will prescribe, okay. And other support to the pharmacy practice, like for example, patients are not refilling the medications, and when patient come, then you will be alert that, oh, patient have been missing the last one or two refill. Or let's say, for example, patients is having medications that require therapeutic drug monitoring, like for example, phenytoin, carbamazepines. Okay, so then it will help to alert that we will conduct the therapeutic drug TDM for the patients. Okay, so everyone, including pharmacists, for the clinical view, will be able to utilize the health-related data in the electronic health records. Okay. So this is another example of the medical records being shown here for another particular example patient, Frank Smith. Okay, with all the, for example, they taking any medical insurance, previous history of admissions in the emergency, and then here you can see what are the doctors treating these patients, medication prescribed, history of these patients. Okay. So if you can also here seeing, for example, if these patients allergy to penicillin, hence penicillin, if it's penicillin is being prescribed, there will be alert pop up asking, okay, patient allergic to penicillin, shouldn't be on penicillin. So in this case, patient is given Bactrim. In this trade name is called Trim. So if you study your antibiotic well, you know that Bactrim is sulfatomexazole plus trimethoprim. Combinations commonly used can be used for different type of bacterial infections such as ear infections, urinary tract infections. Okay, it's also used in patient with HIV. Okay, to prevent opportunistic infections. Okay. So then you can see that the nursing records here, for example, the term of nutrition, patients is in at this particular times not giving any food or drink. What are the patient having amputations of the limb, upper limb, at the arm, because due to the fracture of radius. Okay. And so then you will see that the patient's temperature fluctuations. From the temperature fluctuations, you know that if the antibiotic is effective or not. Because if the antibiotic is effective, patient's fever should be subsided. Okay. Okay, so just now we talk about the health record, which is also medical records. What so in the IT era, we electronic health records can be implemented. Why I say so? Example, hard disk is, if you during my era when I was a pharmacy student, we use this floppy disk, and then slowly then we have pen drive, and then now everything is cloud based. Okay, you don't have to use a pen drive now, because information you can save on Google Drive, OneDrive, or Dropbox. Okay, so same thing also, now all the electronic health record is cloud based. They save on the cloud base, just like all your TikTok they photo, Instagram photo. Where does it save? It's saved at the data center, which is creating a cloud saving record system where your information is securely safe. Okay, and also being actually saved in the cloud. Okay. So what is the electronic health medical records? It's the uniform medical records for standardizations. This, as you can see just now, there's a information tab that you can fill in under who's the doctors that will be captured automatically. Okay. Ability to access medical record from any location. So the doctors from different part of the world, when they're provided access to the electronic health records, then they will be able to see your clinical data or health data. Okay. So here, documentation and codings, very important. Remember just now there's a term called data mining. So imagine, let's say, for example, at Surabaya, if it is electronic health record of all patients, then we were able to see that the prevalence of, for example, diabetes, prevalence of different diseases, then the Surabaya City Council will be able to come up with a more concrete and specific community health plan, okay, to reduce all these diseases. Okay. So in a way, it can be used in the clinical trial also. Okay. So now we are talking about real world data. Okay. Or in post marketing surveillance, all this information can be used can be taken or can be extracted from the electronic health records. So what is transcriptions? For example, if I work in a hospital pharmacist last time, when the doctor prescribed a printed prescriptions, okay, then I have to key into my pharmacy record system. Or when I have to then look at the written prescription, sometimes with very bad handwriting by doctors, so the transcriptions error can happen because, let's say, when they written 50, sometimes can be misinterpreted as 5 milligram. So this is considered as a significant error because of the dose, the wrong dose, if it's wrong dose given. Okay, let's look at the different functions of electronic health records. Okay. First of all, it helps to capture the information using a defined vocabulary. So there is a WHO code, systems. For example, the document, if it's hypertension, what is definition of hypertension? Is it above 140 or over 90, or what are the cutoff points to define someone as a hypertension? So here that's the there's a vocabulary and these definitions that can be applied throughout. So accessible, as I said, by the authorized individuals, it's like a key. You need to have the key to access to the electronic records. Containing a problem list, patient's clinical problem and current status. If you recall back just now, then we can come up with a pharmaceutical care plan for the patients based on the problem list. Okay. Support systematic measurement and recordings. If you recall back just now, all the patient temperature is documented real time, and then we were able to monitor the progress in terms of infections, for example. Okay, then also for audit purpose, let's say, for example, if this antibiotic is prescribed, then we were able to see, is it rational or not? Is it based on the culture and sensitivity data? Okay, or is it patient's the allergy? If it's patient allergy to penicillin, okay, if it's a penicillin group of antibiotics still given, so obviously this is not rational. Okay. Okay, what's the advantage or different advantages of electronic health records? Okay, compact. You don't have to. That means if you recall back, if it's printed documents, there's the whole stack of documents, isn't it? But if it's electronic health records, you can use it just using your mobile phone or iPad. Okay. Concurrent use is real time. All record will be simultaneously updated. Okay. Easily copy and archive so that you don't when you want to retrieve information for the let's say last 10 years or 2 years ago, you can just click a few buttons, all the record will be available. Okay. Portable, as you can see, you can use from your mobile phone. This is also later we will discuss using the IoT, Internet of Things, okay, using wireless connected use wireless device. Secure if it's not being hacked. Recently also, the Malaysia Kuala Lumpur airport, the system have been hacked. Okay, therefore causing some delay in the flight. Okay, so the web security is very important. Okay, support many other services. For example, all these things can be integrated. For example, if you want to do research, then as I mentioned, you will be able to see the electronic health records for, let's say, particular diseases that you are interested. Okay, what are the disadvantages or cons of the electronic health records? Let's quickly go through. So you need to have the computer, laptop, or at the pharmacy and the ward. You need to make sure that there's software to run the system, and also an antivirus software, and maintaining all these computer and software. Okay, so you need to provide training to all the existing medical teams on how they to operate and use these electronic health records. Okay, so data safety again is can be compromised. So for example, the example I mentioned about the KLIA system was hacked and then causing a flight delay. If it's hospital records is being stolen. Okay, if it's paper based, if you want to take the 20 records, you will need to use a small van. But if it's the electronic health records, the whole thing, okay, the whole electronic record can be siphoned or can be taken, can be stolen. Okay, there's no physical, isn't it? It's not physical information. Everything's on cloud. So the whole cloud data can be wiped out. Okay, or if it's electron power cut, there is no electricity, so the system will go down. Then you have to revert back to the conventional printed documents or based on the paper documentations. This is the examples here shown at the London Hospital National Health Systems, where at one time there was their medical record was being hacked and then stolen. Okay, so that means that the patient's privacy is compromised. Their electronic information, their medical information is being stolen, is being leaked to for example, any third party that can use, for example, to contact them, okay, or causing, for example, scam. Okay, shall we take a quick short break? Maybe 5 minutes break, and then we come back at 8 o'clock. Okay, let's take a short break. Okay. When we come back, then we will do the Internet of Things. Okay. Okay, welcome back everyone. So now let's start on the Internet of Things, and also then we were going to discuss the group work involved, okay? So just to recap, just now we're talking about translation of pharmacy practice, and also if electronic health records, including the role of informatics pharmacists. And now let's look at another area of IT, Internet of Thing or IoT, okay, which everyone have been using now, either conscious or unconsciously, that we have been using IoT in our daily life, including different transport system in communications and also hospital and healthcare. Okay, what is an IoT? Okay, IoT refers to physical devices that are connected to each other or cloud services via internet. So first thing is you need to have internet. Without internet, then they would not be able to connect to that IoT. As your name mentions lah, internet access Wi-Fi is crucial for this one. Okay, so you have physical devices, for example your mobile phone, your car, okay, your smartwatch. Okay, what are the IoT systems in your home? Your, for example, your televisions, game console now also is part of the IoT system now, connected to RFID. Okay, heat, your aircon, okay, smoke alarm can be trigger, uh, and home security. This is quite common. For example, you can have the CCTV connected to your phone. Okay, different type of appliances. Your fridge now also can be control temperature remotely from your phone, and then you can operate your ovens remotely using your phone. Okay, so for mobile systems, all these your smartwatches, okay, any kind of devices, wearable technology. If you have your pet being wearing the pet tracking collar, sometimes they have the chip embedded. Okay, smart car also, now your car also, you can start your car even though, or the car can be uh, self-driven. Okay, okay, let's look at the application of IoT in the industries. Okay, in pharmaceutical factories, automations, or including hospitals also, in the outpatient pharmacy automations can be used to pre-packing medications, and also, for example, packing medications, and also for part of the dispensing system. Okay, so we're going to focus on the use of IoT in pharmacy practice and pharmacy. Okay, so all this, how IoT operates, what are the techniques or what are the technology involved? Okay, so just now I mentioned this RFID, isn't it? They have the sensor and the software to help to capture all these sensor informations, and so there'll be different devices that collect and then transmit this sensor. Okay, so all these devices can talk to each other using AI now. Okay, and then mostly it can be controlled using your smartphone or your laptops lah, using different software. Okay, so the most basic one, for example, your sometimes in your house when you have this CCTV or your lock Door lock communicate with light. When you arrive, when of using facial recognition, it can open the door. Okay, without using a physical key. Okay, this is quite common now. Like this Apple Watch or a different type of smart watches. Okay, that can capture your heartbeat and also your ECG. Okay, so it was like constant 24-hour heart monitoring system. Okay, and then you also have can trace your beloved cat. Make sure that it is within always safe. Okay, just like for example, there are pro and cons for using electronic health records. Okay, the IoT also is not perfect. Here you can see four potential disadvantages of IoT. For example, your personal data can be compromised, can be hacked by hackers. So the might be stolen. Okay, once stolen, for example, or one if your safety is compromised. Okay, if there's a potential theft can be uh, ca- can be done. Let's say, for example, they can deactivate the car brake or can deactivate the alarm system. Okay. So they can use your computer to hack or to attack other computer or devices, which could the person, the victim can be a scapegoat in this case. Okay. Most devices require internet, so if it's without internet or if the internet system is down, Wi-Fi system is down, so the system cannot operate. Okay. Okay, let's take a look at the different IoT case studies. Here I presented two IoT case studies. One is a student's innovation. In fact, they have come up with this smart Internet of Things mobile medication dispenser. Okay, so if you're looking at your parents or your older relative when they need to take chronic medications, for example, antihypertensive drug, diabetic medication on daily basis. Okay, one of the thing is either they miss their medications or they take the wrong doses. Okay, so this smart IoT mobile medication dispenser, mobile means it can move from places to places. Okay, to alert the users. Okay, so first of all, as a pharmacist will store all this medication in the dispenser so that it can be dispensed out. uh, okay, so you can set the timing at the timers lor. Let's say for example it should be taken 9 o'clock in the morning every day. Okay, so the data information then will be captured through IoT to the dispenser, which is this dispenser is actually stationed at the patient home. Okay, so this dispenser then can be attached to a mobile system. Okay, which just like the robot cleaner at home. They will clean and mop the floor. The same thing also here. It will move around and to detect uh, where are the patients or the right patients, and then when the time's up, then they will go to the patients and then dispense the medications to directly to the correct patient so that they will take their medications. Okay, so this is one of the inventions that come out by the students. So we are talking about collaboration with various teams. You can collaborate with work together with engineering students, computer science students to come up with different devices for pharmacy system. Okay, let's take a more another example. This is, for example, more holistic, looking from end to end how IoT can be incorporated in daily life, because involving, for example, dispensing of medications, monitoring of patients at home, and also supply medications to the patient doorstep. Okay, so this is such considered as an ideal pharmaceutical systems. Okay, often connected using mobile apps, applications. Okay. Okay, let's navigate through this complex ecosystems. So we term this pharmacy of the future because it's well connected with other ecosystem or other activities. For example, with medication center, okay, it will provide, for example, all the medical records to the mobile apps. The pharmacy of the future here is actually captured inside this. Sometimes they call it super apps or a single mobile apps that operate various system. Okay, it's connected to the supply chain also, where you can order your medications. Okay, and then warehouse where this delivery should deliver their medications, and also connected to physical brick and mortar community pharmacy. If necessary, they can provide this medication to the warehouse and then supply to you. Okay, where you also connected to the pharmacist to for any counseling, required counseling. Okay. Okay, what you need to do next is I'm going to describe various IoT applications using the persona of this patient's Anna. Okay, please take your pen and paper, write down various IoT applications that involve. Okay, so we're going to discuss this application later. I would like you to type it out on the chat box later after I've gone through it. So meet this particular persona, Anna, which is a call center employee with the type 2 diabetes, taking now insulin. Okay, so she could be type 1 diabetes patient also, which she have to rely fully on insulins. Okay, so unfortunately, Anna recently got a cold, and then so she wants some medications to reduce all this running nose, chill, okay, symptom of cold. Okay. So she have decided to go to see the doctors. Okay. Does she have to go to the physical medical centers? Okay. Or she can also do a teleconsultations. Okay. So using teleconsultations, Anna can consult the doctors, and then the doctor will talk to her, and then she can also use her smartwatch to detect any temperature change, or is there any change in terms of the blood pressure or heart rate. Okay. So here that is the interface of the teleconsultations. Okay. So there are two options here. She can go to the pharmacy, which is linked with the medical centers, where the doctor already prescribed the medications, or she can ask for a delivery. Okay. So before going, she already ordered the medication. So she just need to go and pick up the medication from the vending machines. If necessary, also then she can talk physically with the pharmacist. Okay. So in the pharmacy section of the super apps, the Anna will be able to access the patient's pharmacy records, deciding how many, what type of medications that she will know what kind of medication have been prescribed by the doctors, and she can determine whether she want to fill the prescription or not. Okay. So once collect the medications, she go home and then stay at home to get well, and then here I put access mobile apps, okay, which is the name tentative, or the code for this mobile apps, and then the mobile apps pick up information that Anna have filled the prescriptions and then bought medication 1 and 2. Okay, so the mobile app will start sending reminders to Anna to ask them, okay, it's time for you to take this medication now. Okay, if she have taken her medications, then she can uh, input this information in the mobile apps, and then the mobile apps will also check the temperature to see that if it's the antibiotic medication, for example, ibuprofen, paracetamol, really works for this Anna. And if Anna want to know more information about the medication that she have bought, then she can scan the barcode and then get the right informations, for her, including, for example, the dose, storage requirement, and also, for example, expiry date of the medications. Okay. She also can check any potential drug interactions with the supplements she's taking. Okay, because she might be using some health supplements. Okay, let's say if Anna suffer from some potential side effect. Okay, let's say now she feel abdominal pain, is maybe caused by the medications. Then she can use it to do a video call with the pharmacist of the hospitals, or the community pharmacy, okay, to get immediate confirmations whether she need to stop the medications or reduce, or temporarily hold the medications if it's really induced by the medication. Okay, and at the same time, the smartwatch of Anna will be able to check the blood glucose, okay, continuously. It is the is available now. They call it CGS, continuous glucose monitoring system. Okay, so the smartwatch then will, through IoT, will be able to capture the information if this blood sugar is high or low. If it's low, then she need to adjust her insulin. Okay, if it's high as well, okay, need to increase the insulin doses to make sure the glucose in the therapeutic range, or in the correct range. Okay, recommended range. Okay, so the AI system also will be able to use based on the previous glucose monitoring or glucose readings. They will be able to suggest what are the recommended doses for Anna, for that during sick day. They have this sick day management whereby the insulin requirement normally will increase. Okay. So questions from any student? If not, then we can continue. So let's say, for example, if the insulin pen is running out of stock, and then so it's time to refill, instead of forgetting it, the system will automatically refill the insulin for Anna, or sometimes Anna have to can use the voice assistant, like for example, hey Google, that's the Google's function that you use to activate refill, and then the order will be sent directly to the pharmacy, and then the pharmacy will be able to send it to the courier and then using cold chain, because as you know the insulin need to be in the 2 to 8 degrees Celsius. Okay, sorry, the in the not 2 to 8, 2 to 8 for the insulins, the sorry, 2 to 8 for the vaccines. Okay, so depending on the storage, it should be in the right temperature. Sorry, yeah, correct, 2 to 8 for the insulin as well. No, wait, I confused with the vaccine myself already. So for insulins, it should be at the right temperature, so to make sure that it is exposed. Once the insulin pen start using and the room temperature, then you can use up to 1 month. So if it's you don't have to keep it in the fridge after being used. So the Anna also will get the insulins from home, from the supplier, and then will be sent directly to her home. Okay, so that she have a sufficient amount of insulin. So the insulin also, as I mentioned just now, once the insulin doses, you can record how many insulin doses she have injected, and then it will be able to see that capture in the system, and then the doctor also will know what it will be the her insulin level, insulin taken, and also her glucose level. Okay, if its glucose level is too low, the system will give alarm. Okay, to alert her with its uh, low sugars or hypoglycemic. Okay. Okay, so that are the whole end-to-end description just now for the patient's Anna's management of her insulin and also her cold, using different IoT system. Okay, now I would like you to type down whatever things that you recall. What are the IoT applications that have been used by Anna? Uh, Please type on your chat box now. Okay. So to correct my statement just now, for the insulin also, it's 2 to 8 degrees Celsius during storage, or during transportation also, like vaccines. Yeah. Okay, so what are your responses of the IoT applications? Can you type what a kind of IoT application that you can recall? There are various, isn't it? Okay. Yes, the the mobile apps, vending machines, smartwatch, phone, a fridge also connected to IoT systems. Okay, and more answers, please. You can describe her activities also that incorporated. Recall, if you see she went to pharmacy, isn't it? She talked to she do teleconsultations. Start typing your answers. Okay. I need more responses from you, okay? Grace, yeah, correct. And also ordering the insulin. Okay, more responses, please. Response security systems, baby monitors, not shown just now, but it could be one of the functions of IoT. Yeah? Okay. More responses, please. Okay, video call, yes, things, storing information, blood sugar level, reordering, contact the local courier companies, correct? Okay. So it's good. Thanks for those has responded. So very spotting. Video call, scan for information, delivering barcode or QR code now also. Good. So now let's move on to the next part. So as a summary, these are the key activity or functions. For example, for better diagnostic treatment, fast purchasing and delivery, full information about drugs, long-term medical support. Okay. So with the pharmacy of the future mobile apps, okay, the I call it XX here, the pharmacy of the future mobile apps, XX, okay. So able to share information among doctor and pharmacies with the patient. They can make orders from the not just from the community pharmacy, but from the hospital also. They can collect medication from the vending. Okay, and then also they can refill automatically, and then the order will be captured and then sent to the courier pharmacies. Pharmacy will provide medication to the courier, pick up the medications using cold chain, and then send it to the patient. Okay, full drug information about the drug. They can scan, get the read the information, tailor-made itself. Talk to the pharmacist through video call, okay, video conferencing, video consultation, and then all this information is being captured, including how much insulin is being taken and used, how many insulin plans being used, what are the post readings throughout the day, and they can tie up with the patient temperature and symptoms also. Symptoms cold and flu symptoms, okay, including the respiratory rate. Okay. So these are the different approaches that can help to run this cloud-based IoT system, which based on the AI and machine learning, that can help to predict, for example, patient's insulin requirements, okay, patient's insulin order, okay, which can then integrate with the hospital system, pharmacy system, laboratory, including all their lab report or lab results. Okay, now half an hour to discuss of your group work. I do understand we have a large group of students, around 300 in this cohort. And then, so this is a group work, and you are expected to prepare a video, okay, about IoT, and then the video should be uploaded on YouTube. Okay, let's discuss how you can do it. So first of all, to understand the fundamental of IoT, and then the relevance with the pharmacy area or pharmacy practice. Okay. Identify and describe different type of IoT applications in pharmacy practices, and then evaluate objectively, based on your group discussions among your group member, the benefits, challenges, and then the ethical consideration of IoT applications. Whether ethical consideration here means, for example, whether it cause potential harm in terms of data leakages to your scammer, all these hackers, your personal data records, or is it able to your information when you do teleconsultations, or how whether it can actually cause any kind of harassment to the patients. Okay. So work as a group can be up to 4 members. Okay. To develop effective academic video presentations. Okay. These are the suggested tasks role of each member. So once you put yourself into you identify your group member, maximum 4 per group. Okay. So then you choose you can come up with the content first, and then each member have to do the presentations. Okay. And it can present, for example, member A first talk about IoT in pharmacy. Okay, so define what is IoT, and then its relevance, why IoT is important for pharmacy now. Okay, how IoT technology is being used in pharmacy sectors. Okay, so this is for presentation part 1 by member 1, and then follow is in the same video. Okay, same video continuous, member by member. Okay. So member 2 will talk about applications and also different case study. Present to review example IoT in pharmacy. For example, smart dispenser I mentioned just now. How to make sure that the in and out inventory control is optimized. Vaccine storage, just now talk about 2 to 8 degrees Celsius for vaccine and also insulin. Okay. Describe how this technology works and their observed outcome. Okay, is how it can improve in terms of the patient's clinical outcome. Okay, let's say for example, hemoglobin A1C, blood glucose is well controlled. Okay, what are the benefits of application of IoT system? For example, advantages of IoT in terms of improving patient safety and efficacy. So patients is more secure in terms of don't have to really travel so often to the hospital or community pharmacy. Okay. And then what are the possible drawbacks? Okay. For example, does it involve additional cost or not to the patients? Data privacy, do they have like Wi-Fi? Is the phone must connect to the Wi-Fi? What about those rural areas that doesn't have a very good Wi-Fi connection? Okay, because if you want to do a video call, the Wi-Fi should be stable. Okay, you should have sufficient data. Okay, any potential ethical legal considerations. For example, if someone has go into the system order or change your insulin doses, that can potentially harm yourself. Okay. Conclusions and presentation coordinations. For example, summarize the key points, summary of your presentation, how is applicable to, for example, to community in Surabaya, Indonesia, or other part of the world. Depends where your country of origin. Share recommendations for the future of IoT, what you foresee based on your reading, based on what you have read. Okay. You can gather information from ChatGPT, but make sure that the ChatGPT information is not hallucinated. Make sure that it is validated information with the right references, because you want to include the references also. Okay. So now if I mention, if here mentions real example IoT in the pharmacy, these are some of the examples. You can add on more examples, depends on your personal your reading. Okay. So at least 2, some example, for example, smart pill dispenser, IoT in vaccine cold chain management, especially now about disease act. So we already survived the COVID era. Now what about COVID 2.0 or other kind of super infections? Okay. The use of RFID in drug inventory and restocking, both in the community pharmacy and hospitals, or it will be in the wholesaler. Okay. Remote patient monitoring for chronic illnesses. Okay. Wearable biosensor for adherence, for example, just now the smartwatch. Okay. You will be able to, let's say, how to detect your heart rate, to see that whether you are taking your arrhythmia medication, for example, amiodarone or digoxin, whether the effect of the medication is intended, or whether if the effect is too strong over the limit, then you need to order for blood test for therapeutic drug material. Okay. So we can discuss also IoT in the ADR monitoring of pharmacovigilance at a larger sense, post-marketing surveillance, and alert system in the, for example, electronic health record that I mentioned just now. Okay. So all these things are very new. You can access all this further information from internet, or you can gather all this from your own readings, from articles, journal articles. Okay. Okay, now I want to show you the format for the presentations. Okay. It can be up to 10 minutes. There's no Q&A. So, okay. All member must present based on the suggestion just now. What are the areas that need to be presented? Okay. Visual are very important to make sure that all these images, diagram, or you can provide video also, as I shown just now, as part of your visual enhancement. Okay. References. Make sure that you include at least 5 sources of references. Make sure that it's valid. You cannot just say, oh, based on ChatGPT. That is not the correct references, because the response of ChatGPT is based on your prompt. Okay. APA format. Okay, this one I make it at the end of the slide. So if you're doing, most likely I assume you are doing slide presentation. If you are not doing slide presentation, you can do like a Brian did now with you yourself, or you can use any avatar to present the information, but then you have the references embedded in each slide or at the end of the slide. I'll leave it to you. It's quite flexible. Okay. Format also, it can be used here the APA format or the different formats, as long as I know what references that have been used, which article you have read, which website you refer to. Can be below the slide or end of the slide. Okay, depends how you want to do it. Okay, these are the rubrics for this video. Total are 20 marks. Okay, so for example, content accuracy of the content. Okay, clear relevance will get you 4 points. 4 points is the highest. This one weightage, if you can see, total is 20 marks. So the marks that you get will times weightage. Okay. So if it's incomplete or inaccurate content, then you will get 1 mark. Okay. Case study, remember at least 2 case studies. Real relevant, strong relevant case study is used, and you get 4 marks. If it's missing example or just one example, then you get less marks. Okay. presentation skills, engaging, good pacing, and then show teamwork, everyone presenting. So not one, maybe all members presenting almost 2 minutes. Okay. In English, presenting in English also. Generally clear and organized. Okay, then you get 3 marks. If it's not organized, 1 mark. Okay. Slide quality. This one visual use. Make sure it's easy to read, easy to follow with for example graphic. Okay, diagram. And you get 4 marks. Other than that, if it's not appealing, hard to follow, then we'll get 1 or 2 marks. Okay. Team cooperation, for example, each member they will introduce themselves. Let's say I am Long Ming. I'm going to present this part. After you finish, they say, okay, I now I will the the next presenter will be my. He's going to talk about what, and followed by the teammate. Okay. Anyone like to ask questions? If not, please make sure you unmute. Okay. Okay. Now, so if it's not so well coordinated kind of video, or there's only just one member, then you will be penalized by getting 1 marks. So, but if you can see the weightage are highest, five each for all these three main criteria. So, okay. Okay, so how to know which member? I have provided a link here, which I can show on the chat box now. You can now indicate who are your group member. Okay, here. Hang on, yeah. Here also I want to show you an example what you need to do. But I need 2 volunteers. So what I foresee is there will be around 90 group. No, around 70 group. 75 groups. So there will be a lot of video that will be, the video need to be uploaded on YouTube. Yeah. Okay. How you can upload on YouTube? So these are the example. So this was previously with my Brunei students. So they have created this personal, not folder. This is for example account or their groups. Okay, these personal groups where they have posted all this video there. So I would like to suggest there will be two. So your whole cohort maybe can divide into, for example, half of the students will upload their video on portal A, another half of the students will upload their video on the portal B. Okay. How? So these two group leader or cohort leader, I will should call it cohort leader will be better. You will create your YouTube account. So you can create one Gmail, which then allow you to create your own Google YouTube account. And then from your YouTube accounts, then you can create this video portal. Okay, when then all the other group members will be able to upload their videos. 4 students in one group, isn't it? Okay. So let me just show you here. Maybe it's a bit confusing here. So now maybe group one, member 1A, member 2, member 3, member 3, member 5. Sorry, 4. And then you will upload your video on YouTube. Then you put your YouTube link here, for example. But that also we need to have here for hot no portal 1 and 2. With portal 1, so let's say you have how many? Let's say 320 students. Divide by 4, there should be 80 group, isn't it? So the first 40 groups will upload their video on one single portals and another one on another portal. Okay. What do I mean here? This is the example. So the volunteer, cohort leader 1 can create one account so that, and then they send then they will allow those people under this portal to upload their video here. Okay. So this is example of the videos from the Brunei student group, which you can see. I can share this link with you now. Okay. So your video suppose is on IoT. The video shown here is about medications counseling. Okay. Any questions? Before that, can I have 2 volunteers so that they will create such kind of portal where other group members or other groups will be able to post their YouTube video here. If not, the the whole thing will be very scattered. Scattered in the sense that it's not in the same portal. I call it as the or same account or same portal. Okay. If it's from your individual account, sometimes we will not able to see as a group how different group perform. Then it will be very easy for us to view like, oh, this particular group, what is their presentation? Second group, what is their presentations? Okay. Can I have 2 volunteers that would help to with the other groups to upload their video?
Excuse me,
Anyone?
Professor.
Yeah, hi.
Can I
Yes,
give you a suggestion on how to
sure. Why
so
not?
we are divided into 5 class. So the A, B, C, D, and I group
Okay.
class. So is it okay if we make like 5 portals so each class could could upload it at the same portal, so the PIC of each class could make the portal.
Yeah, it's great. Thanks. What's your name?
I'm Harriet. So each group has
Harriet. Yeah.
yes. Each class do have a PIC for this subject. So I think it's better for them to make the portal for each group, for each class.
That's good. Yeah. Then we have different portals then. Can I have the name of the PIC from group A? Is it already fixed?
Um,
If it's not fixed, it's fine. You all can add your name here to the this link that I've just shared. So let me remove this color. And then you all can make it into port call it big group 1 2 3 4 A B C D E 5 either one. No, that should be here. Then you indicate here either you are A or B or C or D or E. And then let me add one more section here. Uh-oh, not good. Okay, you can fill in the name of a PIC so that you know who are the PIC person, because they need to authorize you to access their account. If not, then you will not be able to access the account. So
Hi,
help,
I'm sorry for
yeah.
interrupting. We have another class, international class I.
Uh-huh.
Yeah, A, B, C, D, E, and I.
no, it's actually
I.
A, B, C, D, and I, not
Yeah,
E. We have only 5
yeah.
classes.
Okay, good.
Okay, thank you.
Thank you.
This one just to prevent you uploading to your personal Google YouTube website, so that you have a group collective portals where you have all the group inside all these A B C D I, so that it will be easier for everyone to view their videos. Okay, I hope it's clear. So I will provide you. Okay, let's talk about the due date, because I didn't put the due date here. Dr. Andy is kind enough to let you all decide. Can you all give me reasonable due date to start for submissions? Anyone want to suggest? Obviously, it have to be within this semester. I understand you're going for a holiday soon, isn't it? But you can collaborate each other through Zoom among your group members. One due date, please. One date that is feasible for everyone.
Is it okay for 1 month? Because we are going to have a midterm soon, so I think it's going to
Sure.
be hard.
Let's make it 15th May 2025, 5 p.m. in Surabaya time, to to upload final video. Okay. Okay, cool. I hope everyone is clear. What I'm going to do now is Let me quickly share my slide now through the chat box so that you can have all the slide with you. And then if you have any questions, please feel free to email me. I will give you my email address now. I will finish sharp by 10 o'clock. Sorry, 9 o'clock. I like to express my appreciations for everyone who have taken part actively in the class just now. Okay. Any questions from everyone? Anyone? Oops. Okay, found. Bear with me. I'm uploading the PDF now. Okay, you should be able to download the slide today, including all the instructions for the assignment. Okay. And if you don't have further questions, then we can wrap up today's session. Still uploading, bear with me. So IoT is very exciting things because it create you enterprising and then business opportunities. Even though you are year 2 students, you can be a pharmacy business owner also, but obviously you need to look into the account, be careful with how the accounts be handled. You need someone to guide you also, a mentor. Okay, but your creations will be very, very useful. Okay, in terms of how you can come up with a patent. Okay, which will be can be commercialized later on, and then you will be the patent holders, or even the website that you have created will be able to generate income for you in terms of leasing for advertisement, or as a portal for health education. So okay, so it's already there. If you can see the slide. Okay, so I look forward to evaluate your video. Look at your video on what kind of information you would like to share, okay, about IoT. Okay, thank you very much again for your time. I catch up with you all soon. Take care.
Thank you very much, Prof. Long, for your time. And then, adik-adik sekalian, all of you have already counted your presence. So thank you very much and enjoy your weekend. That's all. Assalamualaikum warahmatullahi wabarakatuh. Your presence already counted, yeah.
Thank you, sir.
Salam. Thank you, sir.
Thank you,
Thank you,
Professor.
sir.
Most welcome.
Thank you,
Thank you,
Prof.
sir.
Thank you,
Appreciate
sir.
it, Prof.
Thank you, Prof. I appreciate it.